Is it visible?
Yes, sir. It is visible.
Okay, so I think till here we have discussed body fat percentage, these guys, right?
Yes, sir. Yes, sir.
Uh, Now I think next will be hand-eye coordination test.
Okay, sir.
You know what hand-eye coordination exactly is? Hmm?
Sir, hand-eye coordination is basically for the checking the reaction time of patients.
Reaction time is done when suddenly
Yes,
cope up to
towards the
any challenges during the games. But hand-eye coordination is something like once when both the inputs you need simultaneously, like your motor control and your sensory eye vision, right? So at the time, like high velocity sports like catching, baseball. Have you gone through these sports? Baseball, when somebody hits the ball with a bat. Have you seen baseball? Cricket, तो you see, na?
Yes, sir. Yes, sir.
See, in sports like cricket, it's very important. Like when the moving ball is coming, and you need to hit it with the cricket bat, right? So at that time, your eye and head has to be very in coordination way. They has to follow the ball, right? So that kind of thing is called hand-eye coordination. Some players their hand-eye coordination is poor, so they'll be like mistiming the ball. Then their hands will go have you seen na कि bat पहले चला गया है or sometimes like bat is away behind the ball passed early, right? So that means that hand-eye coordination at that time is lacking, right? So to conduct this test, basically we require a tennis ball, stopwatch, a smooth ball, and assistant is required, right? First of all, 10 minutes warm up will be there. Then athletes whom we need to test will stand 2 meters away with a wall, right? Any smooth wall. So what we'll do on a command of go and we start the stopwatch. Athletes throws the tennis ball with the right hand against the wall and catches it with the left hand. Like he'll be throwing from right hand and catches it and as fast as possible he'll be repeating these movements for cycles after cycles, right? So that will see how many time he misses the ball. That will be like hand-eye coordination test will be there, right? The score on this is 15 to 16 years, more than 35 repetition he will do, that will be excellent. 30 to 35 it will be average, and then below average and average poor, right? So that will be hand-eye coordination test. And then very important test which will be a uh, mix of some test. That is you can say will fast rugby test. It will be requiring running, squatting, because rugby. I think rugby. Have you seen the rugby game? It is
No,
mix of
sir.
it, rugby. You don't know. See,
Sir,
in
I know, but I've never seen it.
have you seen football? Soccer you have
Yes, sir.
seen, right?
Yes, sir. Yes, sir. Football.
See, when you see you have seen soccer. Soccer, a person has to make way with the ball with the legs, right? But in rugby, what he has to do, he has to hold the ball within his lap, and then he has to run around, okay, and then he has to throw to the goal and make a score. So that is the rugby game, and in that the physical contacts and there's that thing is allowed. So athlete has to be very agile and very strength means almost all parameters are required at a peak. American football and rugby, they are almost similar game, and they are very much demanding, right? So in that test, there'll be a group of these tests will be conducted for the rugby players. First, Cooper 12 minutes run test. I think that you already know, right?
Yes, sir.
Upper test it's like 12 minutes warm up for 12 minutes, 400 meters lap will be there, and the athlete will be allowed to run between that. Okay, 30-meter sprint also. See what actually the football and rugby, when a player runs, right? After I think maximum 30 meter he can run, because more than 30-meter run is not required in these sports, because by that time it covers 30 meters, there will be obstacle in between, or they can passing the ball, so that at one time maximum sprint required is 30 meters. So usually we take that 30-meter time, like which is the best for the athlete. So if a 30-meter sprint is more, so we can have that athlete in forward position. If that is like a bit less middle, he can play in midfield. And if he's having very good strength, reaction time is good, but 30-meter sprint time is not that great, but we can use him in defense line. Okay, so that way we shuffle the players according to these tests. And then this 1 minute minute squat test, we have to place a box, and the athlete will be sitting and standing repeatedly. So that will be squat test. That is for lower limb strength, right? And the sit up test will be for abdominals and core muscles. So in that test, 1 minute, how much sit-ups a athlete can cover. So that will be athlete will be lying on the ground with the knee folded, assistant will hold his ankles, so that his knees and his legs are not coming in front. So he'll hold the legs, right? And then he'll be going up and down. So how much repetition he can make, so that shows his abdominal strength, right? So that is also a requirement in rugby. And this 1 minute press up test, this is have you done that uh, push-ups, right? Push-ups
Yes,
has
sir.
you done?
Yes, sir.
So
Yes.
it is the way basically perform for 1 minute, again for 1 minute, and in that the athlete will be on his palms with that shoulder line 90 degree below his shoulders. So at that time he'll be going down, and his knees and everything should not touch the ground, but the elbow should bend at 90 degree, and then he'll come back. So that will be like the press up, and he'll be repeating it for 1 minute. So that is again test for his upper body strength, right? So next test will be 22-meter hopping and bounding test. In that hops, he'll be standing on a place, and he'll hops on. So
Yes, sir.
the athlete will require to stand on a platform, right? Some hopping and bundling activity will be done as fast as possible. Like on the stand, he'll be hopping and coming down, hopping and coming down. So how much time it will repeat, and how fast, how much numbers he do, right? That will be a good score. These are basically tests for agility, right? First, if it is zigzag run test and star run. I think you have gone through these tests, right? Uh, in this, the athlete will start from have you seen the pictures? Are you seeing the picture?
Yes, sir.
See, that way will mark with the cones. Like and then that is like a rugby pitch. So we'll do, we'll just run diagonally, then we'll go up, then diagonally, then we'll go up. So that way we'll do the running. So in that again we'll check the timings. See this below table you see, that is a scoring table for these above test rugby, right? Test 1, how much meters, test 2, how much seconds he is doing, squats will be thirst like how squats he is doing, sit-ups again, sit-ups will be covered in numbers, then press-ups also in numbers, then text 6, that diagonal zigzag run, all the that will be noted in seconds. So this is the
Yes, sir.
this is Cooper 12 minutes run, 30 meters straight,
Yes, sir.
1 minute squat, 1 minute sit-ups, press-ups, hopping and bounding,
Yes.
and zigzag, straddle, and diagonal pitch. These all tests combined will take a score, and then we'll score the uh, according to the rugby performance, right?
So,
Yes.
will the as you stated?
No, no, order can change. Any test we can take before, any take, but main thing is we need to do scoring for all these tests, right?
Yes, sir.
Because see, in rugby, all these parameters are there, right? So we cannot miss one of the test. If
Yes, sir.
it can happen, see this test as we are seeing zigzag run test. Have you seen Illinois test? For
No, sir, not
we can
practically.
replace those tests with another one also. ऐसा नहीं है कि we have to just stick to these tests.
Okay.
See, these tests are giving us some parameters about agility. So these,
Yes, sir.
instead of these three, we can have another three tests for agility. Instead of that lower limb strength test, we can have another strength test. But the main thing is that we need to have the test according to that parameter only. So then scoring will be there. So it can change. It's not a problem ki we'll be having only sticking to those tests. Test can change according to individual, and that depends on choice of coaches also. Which coaches are comfortable in doing and what coaches are taking their data from, right?
Yes, sir.
So now one more thing. Now we'll discuss on our rehabilitation part. Like if we are doing testing, right? Current what we are following the clinical practice model is when a sports physiotherapist, it has to be done on three fields. One is clinical based, one is on field, and third is as a part of research, right?
Yes,
So what clinical based is? Clinical based, you already know, sports specific evaluation has to be there, identify the risk of injury, prehab and rehab we do, right?
yes, sir.
On field, what we'll do, we'll just manage and treat the training and tournament injuries, like on field, whatever acute injuries there, we'll just manage and treat up to some point, okay, and then we'll take them to the clinic and we'll do thorough assessment and rehab, right?
Yes, sir.
On the third front, that research is what when we are sitting on field, we just do their motion analysis, correction in their patterns, okay, and we also suggest that periodization and training module according to our needs. Like if a athlete is coming with a recurrent injury in ankle, right? So what we'll do, we'll just watch his ankle patterns and all, and we'll suggest the coaches also. Like these things has to be loaded more. These things has to be loaded less, so that we can have good rehabilitation program for the athlete.
Yes,
So
sir.
these are the current models. What our sports physiotherapy is going on, right? So what is our focus basically is nowadays, uh, currently, the most of the sports rehab personnel, they are working on prevention part rather than treating, right? What recent studies says, if we'll go by sports with a good protective equipments, good safety norms, and good training and playing environment, so we can at least we can prevent from 40 to 60% of the injuries, right? What we are having, that chronic injuries, muscle failures, uh, these can be prevented, but the acute injuries like bruises, cuts, impact, falls, that are beyond our control, because when once we are playing sports, playing at so much greater intensity, so the acute injuries can happen at any time. But the chronic problems and as well as the muscle failures and all those things we can prevent, right? Okay. So
Yes, sir.
now you see in the second picture, see the injury prevention is at the top, right? And rehabilitation is at the bottom. And the center part is performance enhancement. So what we'll do, we'll try to prevent the injury as soon as possible. Then we'll assess and evaluate his performance. And we'll be looking after his performance throughout the training part, throughout the tournament part. And once injury happen, so again rehabilitation and then return to sports, and then return to sports also we'll plan in a way like the further that part has to be thoroughly monitored so that we can prevent the injuries, right?
Yes, sir.
Now come to the lower down picture. What is basically a predisposed athlete is, and what is a susceptible athlete? Do you can you differentiate those terms, susceptible and predisposed?
So, susceptible, I guess, those athletes which are having mild symptoms or signs, or which have a faulty method of doing some sport, which can give rise to any injury.
See,
And
susceptible is susceptible. What word is like you are somewhat exposed to environment of injuries, right?
yes,
That you can say susceptible. And predisposed is what, like what we are lacking in that athlete, what we can correct at that period, right? So what we are doing, we just initially we do screening process, that is we can say sports injury screening, or nowadays that is called pp also, like pre-participation evaluation, right? So first of all, every athlete has to go through that part. Pre-participation evaluation has to be done, right? Then what we'll do, we'll select those athletes who are predisposed to for the previous injuries, like he's lacking some neuromuscular control, he's having some previous injuries, he's lacking some strength imbalances and all those things. So we'll be selecting those athletes first, right? Then what we'll do, we'll
yes, sir.
we'll take that lot to the training, to the physical trainer or to the coaches, and then we'll just work as a team, like these things has to be corrected before he'll be joining the normal training schedule with the normal training athletes, right? Because the training has to be individualized. But when it comes to team sports or some other sports like football, cricket, hockey, in this individually we cannot train an athlete, right? They has to train as a team, they has to play as a team, right? So that time, if a athlete is having previous injury or some having imbalance, he cannot only be, yes, 5 मिनट बैठूंगा, okay. See, he'll not be a problem to himself. He can be a problem to the other team members also. Because once, if he's not having a good control over the ball in hockey, if he's not having good control over the ball, so he can then pass on or he can get injured to the other athlete also, right? So that way we'll just select those predisposed athlete and we'll make them a baseline correction. That baseline has to be similar for every athlete. Then only they'll be training together. Okay, then predisposed athletes, then it will be susceptible athletes. Susceptible is what? He's like at risk. Susceptible means at risk. At risk when he's playing or he's training. When every athlete is training, there is always a chance of getting hit with the ball, hit with the stick, fall, and any abrasion, any injuries. They are always susceptible for those things. So better if there is no, when events means when there is a event like any training session or any sports event. So if that event is going good, there is no injury, again he will go to adaptation, and then repeated participation he will be doing. He'll be again coming back to the same cycle, right? And if he is getting injured, so we what we have to do, we have to remove him from the participation, right? If he is having no recovery, and if he is recovered fully, then we can again take him to the cycle again. So that way we have to be very like on every aspect of this training and rehabilitation process, we need to look for his injury patterns. When he get injured, how much is the intensity of injury, how much is severity, so that we have to evaluate and make the current training model successful, right? And in a team, what advanced techniques we need require nowadays? I think you have heard of these techniques, right? Manual
Yes,
therapy
sir.
is always beneficial. ISTM is nowadays very much used to release the muscles and fascias,
Yes, sir.
right?
Yes.
Dry needling is again a matter of fact. It is giving good results on trigger points release, muscle spasm release, and all those things. Dry needling is also quite effective in this matter, right?
Yes, sir.
And taping again, taping can be supportive. Taping can be like it can be supportive or it can be inhibitive to the
Yes.
circulation, which is causing any imbalance during the event, right?
Yes, sir.
So these are the current advancement or current techniques which we are using in sports nowadays. So I think that's a model we are working on. So you can ask questions on this because these things is clinical, right? On the in this thing, I think we can discuss more, right?
Yes, sir.
Yes, sir. So,
Okay.
in case if it will be an objective exam, like earlier when we had in January, we had an objective exam.
Okay.
So, it will be more of like the things which you have shown in the PPT, these small kind of questions will be there.
Mhm.
Or we need to read from somewhere else as well.
The test, what you are talking about, or
Yes,
this?
sir. जब भी अगर हमारा एंड सेमेस्टर जब 6 months कंप्लीट होंगे तो वी डोंट नो वेदर विल बी हैविंग द ऑब्जेक्टिव और द सब्जेक्टिव पेपर डिपेंडिंग ऑन द सर्कमस्टांसेस we
Hmm.
had one of the internals as an objective exam. So in
Hmm.
case if it is an objective one, so we will be able to crack the questions from the presentations which we've shared with us, or we need to read
See,
some other literature as well.
no, no, other literature always you need to refer the literature. See, PPT
Yes, sir.
is a matter where we discuss everything in concise way, right? Okay,
Yes.
this is kind of overview what we have to study. Okay, on this each of see what we test we have discussed, like we have discussed a test for agility, right?
Hmm.
Then you need to study the more test and the agility. What are the different tests, right? And what are their reliability? What is their that you can say uh, the what is the way of conduct the test? So that
Okay,
you
sir.
have to study more, right?
Okay, sir.
Because I don't think this one test I have discussed, because if I'll be discussing the test per sports, so it will be thousands of tests.
Yes,
Okay,
sir.
so that thing I think you have to go through the literature or books. You'll get enough literature on I think sports testing and all. So it's
So
not
for
a
the
problem.
sports testing we need to follow, sir, which book? Kabir?
Mm, so it's a book is called TMES. Okay, testing management and evaluation in sports. That is by I think Dr. D.K. Kansal. One book is uh, you can note down by D.K. Kansal. Okay, test management and evaluation.
Test management and evaluation.
Evaluation and sports. Okay, sir.
Okay, that book you can refer. He has like concisely he has shortened down every test, and I think most of the tests are there in this book.
Okay,
Okay,
sir.
that you can refer for testing.
Fine, sir.
And I think every game he is covered for that.
Okay, sir.
Okay, now any questions on this?
No, sir.
No, sir.
Hmm?
No, sir.
I think most of our what topics assigned to me, I think we have covered those topics, right?
Yes, sir.
Anything else you want to ask? See, it's a, I think session where we can discuss.
Sir, I was a little confused about that, the order of the test which you stated in the Wolf Mills test, Wolf Page rugby football test.
This first Cooper test, then sprint test.
Yes, yes, sir.
That's what you are asking. Ki we can do
Yes,
agility
sir.
test first or this test.
Yes, sir.
See, these tests will not be done on a single day also, right?
Yes, sir.
These tests, because once we'll start, every test is demanding, and athlete has to be fresh on these tests. So we can, it's not a problem. See, once we are having a bunch of 20 athletes, right? 20 athletes, what we can do, we can segregate those athletes. Five people will be doing squat test, five will be sit up test, five will be this. We can divide them in stations, right? So that way he will get in between breaks and recovery also, and we can repeat the test. But order doesn't has to be fixed. It can be agility test you can take first, and this sit time and squat test you can take last. It's not a problem, right?
Yes, sir.
Any other thing on the testing you want? Hanji,
No, sir.
No, sir.
nothing.
No, sir.
Anything on sports you want to ask or something? If you have any questions regarding sports rehab, sports will be done just after, and where on primary examination we see he will not be able to further participate. So that's injury seems to be serious. So what we'll do, we'll do rigid taping, and we'll just remove him from the game, rigid tape, and we'll do IC, right? Then second type of tape is K tape. You will be having, I think that is very nowadays in fashion, right? Taping is that what movements in a sports do this kind of taping in certain games. It's not in every game. So these are the basic taping which we have to do. So you did any workshop on taping?
No, sir.
Sir, I have done long ago when I was in bachelor's, only on simple taping.
See, simple taping is basically the pattern of applying the tape will always be similar.
Okay.
It's not a problem. See, that anatomy you need to know,
Hmm.
right? Which muscle group you need are you are taping on. What we are focusing on, K tape and dynamic tape. What will do? There are two type of taping in this. One is inhibitive, one is assistive, right? Inhibitive means we have to inhibit certain movement. So then we'll do inhibitive taping. I I for inhibition, I for insertion. So that time we'll do what we'll do. We'll start the taping from insertion of the muscle and we'll be going the tape up to the origin side. So that will be automatically inhibited to that muscle. And if we'll do the assistive tape, we'll take it from the origin side otherwise and main thing is stretch how much sometimes if you stretch more so it will be like recoiling more so it will further I think deteriorate your alignment also if you stretch the more to the tape and will tape the muscle so it will again I think if lateral ankle muscles will be taped more so it will be eversion okay so again that will disturb the alignment. So that thing also we have to take care of. Okay. So I think if their muscle fibers are horizontal, just take it to the horizontal side. If they are in the recoil way, do it in the recoiling way only. So that will help in, and that will be assisting the ligamental muscle fibers. So that way we can do taping. Okay. I
Okay.
think this is the overview. Rest I cannot teach
Yes.
every taping thing on the this thing. That we
Yes.
need to have some model and we can teach. Okay. No problem. You can ask any question if you have. You can. I think you are having my number also. You can.
Yes, sir.
You can text me any questions, right?
Okay, sir.
Okay, sir.
Okay, sir.
Rest all any other techniques. I think dry needling.
Sir, I know a little bit about dry needling.
Dry needling also is very helpful nowadays. That is to release the basic the contracted muscles or trigger points. It is very helpful. So frequently it is been used in sports nowadays. Cupping is used. Cupping also I think you have heard of. So these are the latest techniques what we are using. Okay.
Yes.
Yes.
Then anything else?
No,
No,
sir.
sir.
I think. Chalo, all the best for your
So it
future.
would be very kind of you if you can share the presentation with me so that I can
Sure.
also have
I
a
think
look
you
at
have
it.
text me on my WhatsApp, right? I'll just send the PPTs on the WhatsApp, right?
Okay, sir. Fine.
Okay, sir. Thank you,
Thank
sir.
you so much, sir. Thank you.
Take care. All the
It was
best.
really a very learning experience getting in touch with you.
No problem. You can if you have any further queries, you can text me. I'll just answer them.
Yes, sir. Sure, sir.
Sure,
Thank
sir.
you so much,
Thank you,
sir.
sir.
Okay. Okay. Welcome. Bye.
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 Thank you, sir.